The doctor who stalked and harassed a woman by abusing NHS data was able to access her personal information without her consent or a valid reason by exploiting a loophole in the system. According to The Guardian, the doctor used his position as a locum GP to access the NHS database and look up the woman's medical records, phone number, and address. He then contacted her repeatedly by phone, text, and email, and even showed up at her home uninvited. The woman had met the doctor briefly at a social event and had no prior relationship with him. The doctor's actions were a gross violation of the Data Protection Act and the General Data Protection Regulation, GDPR, which require that personal data be processed lawfully, fairly, and transparently, and only for specific purposes. The doctor also breached the professional standards of the General Medical Council, GMC, which state that doctors must respect patients' privacy and confidentiality, and must not use their professional position to pursue a sexual or improper emotional relationship with a patient or someone close to them. The doctor was eventually caught and reported to the police and the GMC by the woman, who suffered from anxiety and distress as a result of his stalking. He was convicted of harassment and fined £1,500, and he was suspended from practicing medicine for 9 months by the GMC. However, some critics argued that his punishment was too lenient and did not reflect the seriousness of his offense or the harm he caused to the woman. The case of the Stalker doctor exposed a serious flaw in the NHS database system, which allows doctors to access patients' records without any checks or audits. This means that doctors can potentially misuse or abuse patients' data for their own personal or malicious reasons, without being detected or held accountable. This poses a significant risk to patients' privacy, safety, and trust in the healthcare system. To prevent such incidents from happening again, some experts have suggested that the NHS database should implement stricter security measures, such as requiring doctors to provide a valid reason for accessing patients' records, logging every access attempt, and alerting patients when their records are accessed. These measures could help deter doctors from abusing their access privileges, and also enable patients to monitor who is viewing their data and why. The woman who was harassed by the Stalker doctor decided to report him to the police and the NHS after enduring months of unwanted calls, messages, and visits. She was terrified by his obsessive behavior and feared for her safety. The police investigated her complaint and found evidence that the doctor had abused his access to NHS data to obtain her personal information, such as her address, phone number, and medical history. He had also stalked other female patients and colleagues, using their records to contact them and ask them out. The doctor was arrested and charged with multiple offenses, including stalking, harassment, data protection breaches and misconduct in public office. He pleaded guilty and was sentenced to 5 years in prison. He was also ordered to pay compensation to his victims and given a restraining order that banned him from contacting them or working as a doctor again. The NHS also took action against the doctor and referred him to the General Medical Council, GMC, the regulator of doctors in the UK. The GMC conducted a fitness to practice hearing and found that the doctor had breached the professional standards and ethics of the medical profession. He had abused his position of trust, exploited vulnerable patients and violated their privacy and dignity. He had also brought the reputation of the NHS into disrepute. The GMC decided to strike off the doctor from the medical register, meaning he could no longer practice medicine in the UK or anywhere else.